Right, I think I'm going to get started. So hello everyone, and welcome to London Sport and Mayor of London's Talking COVID-19 and Sport webinar. This is the 7th in a series of fortnightly webinars being delivered by London Sport in partnership with the community sport team at the Mayor of London's office. And it's designed to help London's community sport sector address some of the challenges that are being experienced as a result of COVID-19. For those of you that don't know me, I'm Kerry Atherton and I'm a project manager within the community sport team at the Mayor of London's office, and I'll be chairing the discussion today. Before we kick off, I would like to go over a few housekeeping notes. As you'll see, we will be recording this session to send out to a wider audience afterwards. As with previous webinars, I'm conscious of the accessibility challenges of Zoom and delivering in this format. This is quite clearly particularly important today, given the subject of today's discussion. So I'd like to apologise on behalf of our organisations that we still haven't managed to find an effective way of subtitling our live webinars. But as a short-term solution, we will be releasing the recording with full subtitles afterwards. So as a bit of an introduction and a reminder, Talking COVID-19 and Sport is a series of webinars that have been developed in response to COVID-19 to address the biggest issues facing London's grassroots physical activity and community sport sector. And really, we want to use these sessions to offer some practical support during the crisis. Each webinar is led by a representative from the Mayor of London's community sport team and a representative from London Sport. And for each webinar, we will also bring in external industry expertise to provide independent insight on the topic. I'm pleased today that we'll be exploring disability, inclusion and resuming physical activity. It's been well reported that the effects of COVID-19 have exacerbated pre-existing inequalities in London. New research shows that government policy responses to the pandemic, including the ongoing lockdown restrictions, have disproportionately impacted Londoners who are disabled and/or have a long-standing and limiting illness in many areas of their everyday lives. From a sport and physical activity perspective, even before the COVID-19 crisis, disabled people face real challenges in accessing opportunities to be active and therefore are twice as likely to be physically inactive compared to those without a disability. It's important that disabled people should not be thought of as one homogenous group, and there are many complex reasons for high levels of inactivity and inequalities faced by disabled people, but that the crisis has only heightened these further. As we all know, the government are easing lockdown restrictions and there are great opportunities now to be active. So it feels like a good moment to be addressing these barriers that have existed for a long time and discussing in this webinar how the community sports sector can better support disabled Londoners in returning to physical activity so they're not neglected and left behind. So to deliver this topic today, I'm joined by two speakers. First is Alex Gibbons, Specialist Advisor on Disability at London Sport. And Alex leads on the London Sports disability work for the whole organisation, which has included developing and driving their disability subcommittee. And our industry expert this week is Leanne Whiteman, Head of Programmes and Impact at Disability Rights UK. Leanne works on the Get Yourself Active team, which works with disabled people, user-led organisations in both the social and sports sector to increase opportunities and reduce barriers when it comes to disabled people getting and staying active. So thank you both for agreeing to speak today. In terms of the running order, we'll start off with Alex, who will give a very brief presentation and give a chance for Leanne to kind of respond to set the context for today's discussion. And then for the second half of the session, we'll open up for questions from the audience. And we've also had some pre-submitted questions that we'll address too. As Chris has already mentioned in the chat, please feel free to use the Q&A function from now and the comment section to kind of send in your questions as we're going along if you want to respond to anything that's been said. So without further ado, I guess, Alex, over to you for your presentation, and thanks everyone.
Great, thank you very much, Kerry. Thank you for the introduction. As Kerry said, I'm the Specialist Advisor for Disability at London Sport. I'm sure I know many of you who have tuned in today. My role comprises two functions really. First of all, it's about working with partners and stakeholders to support, influence in some cases, everyone to embed disability inclusion into everyday working practice. I've also got a really important responsibility at London Sport as well, working across all our different teams, our directorates, working with all of our colleagues to make sure disability is embedded into everything we do as an organisation. So that's me now. If you have a look at the next slide, we can see me about 32 years ago, something like that. I'm giving away my age there, but and that's me, the skinny one diving for the line with, believe it or not, a full head of hair. I was competitive even back then, as I was on a school athletics day somewhere in North London. And the reason I put that up is to show that I was, I guess, lucky enough to always love sport. If I wasn't desperately trying to win a race like I am there, I was hitting a tennis ball against a wall for hours and no doubt breaking loads of greenhouses as I did it. Then as I grew up, sport kind of began to merge with my working life. So if we go to the next slide, we can see a fairly dilapidated looking building there. Some of you might recognise it. That's Barnet Cocktail Stadium. I used to run for Shaftesbury Barnet Harriers when I was a teenager. A lot of you will know that now as Allianz Park, where Saracens play their home games. But back then it was a fairly unkept track. It was sort of crumbling stands, but I loved it, and it was sort of where I kind of learnt sort of the power and the exciting things about sport. I didn't just compete though, I also worked for Barnet MenCap, volunteered for Barnet MenCap, so a local organisation working with people with learning disabilities. And they had a really good sports programme there. And the thing about it wasn't just a nice thing that people did, it wasn't just disabled people jogging around the track, it was a professional coach delivering fantastic structured fun sessions. And it taught me a lot at that age. It taught me the power of community sport. It taught me what it is to be a good coach and what you need to be a good coach. It taught me about being a good volunteer, and most importantly, the many positive outcomes that being active has, whether you're a disabled person or not. So next, what I've done is take, I suppose, a lot of that learning back then when I was young into my work moving up to today and what I do now. And I'm really proud to work for London Sport. We've done lots of good things over the last few years and really improved our work around disability inclusion. And the commitment goes right to the top. We have a board member with disability as part of their portfolio. We have a disability subcommittee, which Kerry mentioned, that I'm part of running. And we have a strategic plan of action and active inclusive capital, which was launched 3 years ago, and hopefully many of you have read. And the aspiration you can see on the slide is the ultimate aspiration of that strategic plan. And it states that deaf and disabled people are at least as active as non-disabled people. And that's a very difficult aspiration to achieve, because where we are now, we have a situation where roughly twice as many disabled people are inactive compared to non-disabled people. That gap has closed quite a bit over the last few years. We're doing pretty well in London, but the gap is still much bigger than it should be, and it shows the inequalities that exist in our sector and more widely as well. London Sport, what we're doing to address that is a commitment to ensuring all projects delivered against our new strategy include disability. So no project will be signed off unless disability is embedded within it and within the thinking in terms of planning that as well. So some great steps there. So if we go to the next slide. We now know they're facing a lot of new challenges. That's what this webinar series is about, the impact of COVID-19, and it's affecting everybody. There's no, I think it's about 90 people listening today, and I bet there's not one of you who hasn't been affected hugely by what's happened over the last 3 or 4 months. So why are we having an emphasis on deaf and disabled people? Well, I think firstly we need to think beyond sport. And what I've put up there is Inclusion London's report, which is Abandoned, Forgotten, Ignored. And it's a pretty powerful title, isn't it? Abandoned, Forgotten, Ignored. And it talks all about the impact of COVID-19 on deaf and disabled people over the last few months. And if you read it, and I really hope you do, a lot of it's actually very difficult to hear. I've been doing this work for a long time, and I found it quite shocking at places. What it does is starkly cover the magnitude and the impact of COVID-19 and how inequalities are being stretched to breaking point, a point where deaf and disabled people are literally fearing for their lives. So I'd just like to take a quick quote from that report. It states that disabled people over the last decade have experienced high levels of structural and historical exclusion and discrimination, coupled with rising poverty and inequality as a result of austerity, welfare reforms, and cuts to public services. And just to be clear, that's before COVID-19. This is what's been happening over the last few years and affecting disabled people's lives enormously and not for the better. So now we think about the current situation. What are the challenges being faced? Well, financial challenges, clearly. Some people can't even afford PPE. Some places like supermarkets, for example, aren't adequately adapted, and this increases anxiety and prevents people from being willing to leave the home. So all of you, I'm sure, can see how that translates to physical activity and sport. You need to give people the reassurances that in the first instance, they feel safe. Same goes for social distancing. Certain impairments can make this more difficult. If you have a visual impairment, obviously it's more difficult to see other people. If you have a learning disability or you have autism, it may be more challenging to maintain a safe distance. So we need to think as a sector or across sectors how we're going to meet those new access needs. People have lost their support networks. Personal assistants might be isolating themselves or furloughed or redeployed or even unemployed due to cuts to services. And also there's a huge extra strain on the social care system. So what can we do? What support can we provide through our workforce, what we call the sporting workforce, or even a non-traditional workforce, health professionals, for example? Information is already confusing. I bet there isn't a single person here who, after at least one of the government briefings, hasn't turned around to their partner, their family, or spoken to their friends later and said, well, what the hell was all that about? I have quite a few times, sadly. So imagine if you have a learning disability, or if you have dyslexia, or if you have a range of impairments that may additionally confuse your revised rights to services and support. So accessible and clear information on getting back into activity is vital with what we do next. Next, over-reliance on digital solutions. I want to be careful here because it's not true, firstly, to say that disabled people can't use tech. Not all disabled people can't use tech, clearly not. And in fact, used well, it's an absolutely vital tool in providing equal access to opportunities. But what we do have to bear in mind is that it's not always appropriate for everybody. And disabled people make up a disproportionate percentage of non-internet users. The report states that it's 56% of non-internet users are deaf disabled people. So a lot to take in there, and I'm not saying this is all the responsibility of the sports sector, but if we're serious about system change, we need to know what the system looks like in the first place to be part of the solution. So those are the challenges, but the next slide shows what people are doing about it, and some great stuff in response already over the last few months to their current challenges. So the first resource I put up there on the left is Activity Alliance's Reopening Activity and Inclusive Response. I won't talk about that now because I'm going to talk about some of the content of that in a minute. Disability Sports Coach, one of our key partners in London, have developed a home activity programme. As part of that programme, they have a home activity pack with guidance that they send out to people's homes so people can be active at home, and London Sports supporting them to get more packs out as soon as possible. Get Yourself Active is Disability Rights UK's programme. I won't talk about that now because Leanne will cover that, I'm sure. And then we have some resources there from British Blind Sport and UK Deaf Sport. So video content. British Blind Sport have created some video content there with inclusive fitness training using better audio description. And British Blind Sport have adapted existing resources. So Joe Wicks, they're using BSL and subtitles. So next slide, thank you. So some examples of what we need to think about when reopening activity, and these are taken from Activity Alliance's great resource. I won't cover everything, of course, in this presentation, but I do encourage you to read that resource if you get a chance. So first of all, information and communication, really important to make sure deaf and disabled people are part of the solutions. How do we do that? Well, we want to create partnerships with disability organisations, user-led organisations, local disability charities, Want to develop inclusive advisory groups using principles of co-production. Again, Disability Rights UK does some great workshops around that. Leanne will talk about that. And we want to make sure that deaf and disabled people are equally empowered to make decisions about services. It's more important than ever. It's important to communicate safety measures you put in place to make people feel safe. There'll be new ways of working to help with social isolation. So make sure you have things like meet and greet services, for example, or one-to-one session, or even video tours of facility or sessions. And as I said, not everybody uses technology, so we may need to use other methods that we've used in the past. So GP surgeries, pharmacies to get information out, volunteer services, local authority, SEND teams, or even housing units. Workforce, so important to be realistic about what services you can provide with a reduced workforce. That's reality in many cases at the moment. If you have disabled members of staff, make sure you provide return to work interviews to find out what barriers disabled people face and what support you can provide. And also provide training on any assistive technology you may have brought into play to help with things. Session planning. Consider linking to virtual home sessions. As you'll be aware, there's quite a lot of those, and I described a couple in the last slide. That can be a really good introduction to people who haven't been particularly active over the last few months, giving that confidence then hopefully to progress and transition out into community sport again. You might want to, if you can, address private concerns through one-to-one consultation. People will have very personal responses to the situation. We need to recognise that. And also look at NGB's return to play guidance. There's lots of sport-specific advice, and you can see all the list of the latest advice on the London Sport website. Travel and transport is always a challenge, unquestionably. So can we support participants to develop active travel plans? Can we make people aware of public transport routes or local accessible taxis if they don't feel comfortable using those transport routes? And access routes around the opportunity or facilities themselves. How can we make social distancing easy for those using the likes of mobility scooters or wheelchairs, or who have guide dogs? Or maybe offer people tours if the layout or ways through a facility have changed in any way. And finally, I haven't put it on the slide there, but booking systems, that's come up quite a bit. So think of alternatives to online booking, that's really useful. And ensure those that have previously had concession fee membership are given the same support to return. So finally, there are some positives to come out of this situation. It doesn't feel like it sometimes, I know. But there are opportunities at the moment to really put this work in the spotlight. It's absolutely vital that we all do that, as Kerry said, so we don't exacerbate the existing inequalities. We can't ignore this work anymore if we have been doing. So what else can we do? What should we do? We need to use some of the resources I've mentioned. As I said, there's some fantastic things out there to help disability inclusion in everything that you do. If you get that right, I absolutely guarantee it'll be right for everything else you do as well. To help make the changes, work across different sectors to truly understand the impact this work is having on deaf and disabled people. Some boroughs have already established physical activity and sport networks, and some are developing them. And if you're interested or want to find out more about a local network, ask me and I'll tell you what the latest situation there is locally to you. And how do we do that? We will empower deaf and disabled people to shape, as the experts, because deaf and disabled people are the experts, how we deliver physical activity and sports in the future. So that's me and my view from the physical activity and sport sector. But we're really delighted to have Leanne with us to give us a disability sector perspective. So over to you, Leanne.
Great, thanks Alex. Hi everyone, thanks for having me. So Alex has set me up really nicely here. It's just really great to hear such a narrative about involvement of disabled people. It just makes our work a lot easier in a lot of respects. So I just want to start actually by just quickly talking to you about Disability Rights UK as an organisation and what we do, in case you don't know about us. So we've got 4 strategic priorities, and the first one is about building a movement. So we're here to build a movement to achieve an equal society, and we want this to strengthen the collective and individual voices of disabled people and disabled people's organisations to achieve change. We also do a lot of work on independent living. So this work enables, it's about people being able to live with choice and control. And we campaign for equality in everyday life and for the support that disabled people need to lead the lives that they choose. Importantly, we also do lots of work around inclusive economic opportunities. So this is about ensuring that disabled people can work and thrive in employment and enterprise, to ensure that they have the money they need to meet the additional costs of disability. And we campaign for a benefit system that enables dignity and equality. So that might be what some of you might know us best for. And also, I guess, like a really important part of our strategic plan is to influence public attitudes and behaviours. So that's about creating a narrative about disabled people which reflects our intrinsic value, and it's about people being people. Everyone's human, everyone matters, and it's our role to kind of ensure that disabled people are included in that. And so we see ourselves as kind of supporting an increase in visibility of disabled people to challenge negative perceptions. So just to kind of talk a bit about what we're trying to say, what our key message is to all sectors around what's happening around the pandemic. Actually, it's not too different from what we would be saying to all sectors, before all of this happened. But what we want to say is that society now has an opportunity to build a recovery which fully includes disabled people, and we call on government and public and private bodies, including you guys in the sports sector, to work with us to make that happen. And we must together acknowledge that equality for disabled people is not embedded within our culture and institutions, and this needs to be put right in our plans to rebuild our future. So that's why it's really great to hear the way that Alex is talking about involvement and engagement of disabled people. This really backs up some of what Inclusion London says in their latest report, and it's really important that I guess we understand the kind of context in which disabled people are living in order to kind of rebuild our society, and it's useful to think about that when you're thinking about reopening and re-engaging with people. So I work on the Get Yourself Active project, as well as a few other things at Disability Rights UK. This is a programme which is funded by Sport England. It's been around since 2015, where we started off with a couple of small pilots with local disabled people's user-led organisations in Cheshire and Leicester, and we were looking at how people who have personal budgets, the people who have eligible social care needs, who receive a personal budget to meet those needs, become active using that budget and therefore their support networks. And from that, it just kind of blew open a number of learning points for us. And one of them was around a need for the social care workforce to be supported, to encourage people to be active and to point out benefits of physical activity. Something else around building capacity of disabled people's user-led organisations as the grassroots organisations that understand local disabled people as partners, legitimate partners in a system to tackle inactivity. And the other kind of work stream, which I guess is the one that I'm focusing a little bit more on with you here today, is about co-production. And what we found in the kind of early days of our work with Sport England was that where we had the most successful relationships in the sports sector with organisations and individuals who were willing to think really, really differently about how they offer stuff once they'd listened to what disabled people had told them. And we see this as a really, really valuable tool when you're thinking about reopening and re-engaging with disabled people, and actually for any sort of customer base, in fact. So I'll just talk to you a bit about what co-production means to us, and in this context. So to us, it's not just a word and it's not just a concept, it's a meeting of minds and a coming together to find a shared solution. And in practice, it involves people who use services being consulted, included and working together from the start to the end of any project that affects them. So that's the kind of pinnacle of what you'd be looking for in terms of co-production. What we see our role is role with the sector is that we want to talk to people in the sector, in the sports sector, about what co-production means and where it comes from, in order that you have an understanding of disabled people's lives and the disability rights movement and the social model of disability. So it gives you a foundation. So we're not necessarily telling you that you need to fully co-produce absolutely everything you do. To reach full co-production, you may need to change the structure of your organisation, have a total overhaul of the culture and the learning practice that you have. And we know that, you know, that's not what we're asking you to do. The sports sector is a very vibrant and positive and impactful sector, but we think that there might be some quite interesting approaches that you can utilise that we've tried and tested that can help with engaging with disabled people. So you may have seen the ladder of co-production. We've got, Alex alluded to some workshops that we run on co-production, and one of the workshops is on the ladder. So at the bottom of the ladder, it's the idea that you're just doing two people, so you're just putting a service on, expecting people to come and not asking them about what they think about it or if they even wanted it in the first place. In the middle, there is the doing for, so engaging and involving people, and that's where we're wanting to kind of get into some conversations with people and to support organisations with. And at the top you've got doing with, so that's equal and reciprocal partnership, which is not easy. Co-production is definitely not an easy approach to adopt, and it needs everyone to be really, really engaged and invested in it. So what we're saying, I guess, is this is a really, really good model to know about, but it's different. Co-production, involvement, engagement, it works differently in every organisation, in every partnership, which is where we want to come in and kind of give a bit of that bespoke support as we progress with our piece of work that we're doing with Sport England. So I'll not talk for too much longer because I know people have got lots of questions, but building on some of what Alex has already said, there's some kind of tips that you might want to consider when you're wanting to engage with disabled customers and think differently about how you offer your services. And as I said before, now is a really good time to do that because everything has changed so much. We're all in a really different position, a situation now. And again, Alex outlined some of the really significant issues that disabled people face at the moment, not least the most recent stuff about face coverings. So in terms of stuff that you can do now, because I know you're all busy, I know that you're all trying to reopen, reduce workforce. It's not an easy time for anyone at the moment. You can start talking to grassroots organisations, local organisations that know the customer group that you're wanting to work with, and in many situations that will be disabled people's user-led organisations, and in London, Inclusion London have all the information on those organisations, although we might be able to help with that as well. Talk to them, find out, you know, what are the issues that people are facing at the moment, ask the specific questions that you need the answers to, but also, we would encourage you to start trying to talk directly to people, and the grassroots organisations may be able to help you with that. But talk to people that aren't already active or haven't already been active or really struggling to get active, because that's where you get the really interesting insights and the knowledge that you need. If you're going to do all of this, though, we really suggest that you always feed back to the groups and the individuals that you talk to. Tell them what you did with that information, how it helped you to shape your strategy, your delivery, and that will stand you in good stead actually for continued relationships with these organisations going forward. So if you've got more time than that, and I know that that's all quite a lot to do, you can go on our Get Yourself Active website and you can see a number of webinars that we've uploaded now. They're all 15 to 20 minutes long. We're calling them speedy co-production webinars, and they're on a range of subjects around co-production. So we've got one on the history of the disability rights movement, one on the social model, one on the benefits of co-production, one on the challenges. And we've got a number of kind of external partners that are giving some examples of good practice with regards to that as well. If you have even more time than that, then you could actually sign up to our disability rights e-news, which is out weekly, and that gives you a really good flavour of what's happening at a policy level around disability and general policy stuff. But at the moment, of course, it's very, very COVID related stuff happening at the moment. So I would encourage you to look at that, because that might give you quite a good context for what is happening with people at the moment. So in terms of additional stuff, we can actually help. We're really happy for you to drop us a line if you've got any specific questions relating to your organisation, and we can help link you up with the local grassroots organisations as well. So I'm going to stop there and let us get on with the questions.
Thanks, Leanne, and thanks, Alex. We've had quite a few questions kind of come in, I guess, in response to that. And I thought it'd be good to start off. It's something that both you and Alex mentioned around engaging with user-led organisations and making sure that we are speaking and to disabled Londoners when we are developing programmes. So what kind of advice can you give to organisations who are just kind of like starting out down this process? We've had somebody else comment in from the London FA who are looking to kind of set up a disability focus group to make their football more inclusive in London. And they've asked the same. They've currently got 3 to 4 people. So what's the best way of recruiting members for the group? So I guess if you can flesh out a little bit on kind of existing networks that might be already in place, or some advice about how you kind of start to go about this. So I don't know if you want to kind of respond to that firstly, Anna, and I'm sure Alex, you'll also have kind of something to add to that as well.
Yeah, so Alex will have much more local knowledge on this than I do, but I guess in a general sense, it's reiterating that we think about the local grassroots organisations. When I talk about grassroots, I guess I'm talking more in terms of the voluntary sector, the wider voluntary sector. So within that, you'll have disabled people's user-led organisations, and actually a really good way of finding out who that is you type in disabled people and the local area that you're looking at. Sometimes you'll get some really good Google results on that. Inclusion London might have that information. Alex will probably actually have that information in terms of disabled people's user-led organisations. But there are councils for voluntary service, so CVSs, that you can get in touch with, who are engaged with many people, local people, and have mailing lists that they can send out to. So it's not just about either just kind of sending off an email and saying, can you send this, put this out in a newsletter. It's about really talking to those organisations and understanding what they're facing in terms of engaging with these individuals, because they might be, they might be struggling themselves at the moment in this current situation, and building some local partnerships. It's about longevity, not just about really quick engagement.
Yeah, echo all of that. Yeah, and I think it's really important to say that there are some brilliant organisations out there, but they may be really stretched. Might have been stretched before this happened. And so sometimes it's taken us literally years to build up a really good relationship, the local DDPO. Now, in saying that, we haven't necessarily got years, but we do at London Sport have some really good connections with certain organisations that really embrace physical activity and sport and the benefits that it can bring, and happy to sort of pick that up with anybody who's listening in around that. There are also sort of local, sort of not user-led charities and disability organisations as well, some of which are doing excellent stuff, some local MenCaps, for example, and also some of the national charities as well. I think some of you might be on the call. So MenCap and Cheshire, Sense, Scope, a lot of those have sort of services and all of those are doing things around sport physical activity. So it's a bit more of an open door, I suppose, and an excellent way of reaching people who maybe before you wouldn't be able to reach. Other ways through local authority social care teams, housing associations as well, and if you're thinking about children and young people, schools, and not just special educational needs schools. The majority of disabled young people will be in mainstream schools. It's really challenging to sometimes be able to to get in touch with those young people, but that's something at London Sport we're really trying to prioritise and improve at the moment. So we'd like to support you, but also get your help with doing that as well.
Thanks both. We've had a question coming on the chat as well about personal budgets. So Leanne, you might want to start with this one. They've asked, could you please say a little bit more about the learning that you got from working with personal budgets, and any advice on service promotion and how to position a service for personal budget funding. Anything advice on that would be really helpful.
So the first thing to say would be that personal budget funding is very, very tight. So when we were looking at personal budgets and the use of personal budgets for people to be active, we were actually looking at the support around that person for them to be active. So for those of you who don't know what a personal budget is, it's a way of people accessing the budget that they're entitled to based on their social care needs, which have been assessed by the local authority. So usually a social worker will have done an assessment, and someone in the local area will have done some support planning with that individual, or the individual themselves might have done it. And within that support plan, they will be meeting a set of outcomes for themselves. Now, personal budgets, because of the credit crunch in 2008 and the many cuts to local authority budgets, which are very significant at the moment, people are really stretched in terms of what they can use their personal budget for. So although it's actually a way for someone to have choice and control over their life, often the reality is that people are really struggling to actually get access to the support that they need to get out of bed in the morning, or to have food in the fridge, to get the support to make all of that, those sorts of things happen. But we remain really positive about this. We really believe in personal budgets because they come from the disability rights movement. They are a direct result of disabled people saying, we don't want to live in institutions anymore. We don't want to live in hospitals. We want to live in the community, in our own homes. And we don't want to be told how we receive our support. We want to make that decision. And so the idea is that personal budgets are not just about your care. They're about your ability to live the life that you want. And for many people, that should be being active. And as you will all know, disabled people generally want to be more active than they currently are, but there's so many barriers in place that stop people from doing that. So one way that you can kind of look at the use of personal budgets is actually by engaging with people's supporters. So that's personal assistance. So if someone so people have personal assistance if they're a direct employer of their care and support. And there are PA registers on sometimes on DPULO websites, but we might be able to help link you up with your local PA register to help you get in touch with those individuals. Talk to the local support organisations, so any sort of local social care delivery organisations, and you may, if you've got some really good links in the local authority social care departments and you have good links with social workers, then start talking to them. We're doing a load of work around this, so we're really happy to give you more information on it, but those support networks are really, really important for personal budget holders, and probably less thinking about money within the budget that can be utilised, more thinking about how those individuals can support disabled people to get active.
Thank you. We've had a couple of questions in, probably not an easy one to answer, about kind of returning to physical activity again. And someone's mentioned, so like, first of all, like when it would be good to get your kind of opinion about when you think it might be safe for disabled Londoners to return to physical activity. But someone's mentioned around the kind of NGB's guidance on return to play for their specific sports, and mentions that they don't have specific things in there about how you might make sure that is safe for and meet the needs of disabled Londoners. So is there, I guess it's your kind of personal opinion, is there a gap there, and is there any kind of like advice or anything that needs to be done further to make sure that we are addressing this in kind of return to play guidance for specific sports? Not an easy question. Alex, you want to kick us off?
Right, it's my opinion. Okay, so I guess the first thing is, as providers, you need to be confident that the service or the activity or the sessions you're providing are as safe as they can be, based on all the guidance that I've spoken about. And there's more stuff out there as well that we can perhaps send on afterwards, and some impairment specific guidance, like the British Blind Sport, the UK Deaf Sport, yeah, loads of great stuff. But also, there's probably not a blanket approach, because it's the same for non-disabled people. I know some people who won't go out of the house at all still, whereas some people who are sort of kind of back to normal, really, in terms of going out. So I think that's the same with non-disabled people as well. And that's why I was speaking, and Leanne's spoken about, it's really important to understand the specific challenges, anxieties that deaf and disabled people are facing. Because it's very, very difficult. I can't sit here, none of us can, and second guess how a person's feeling. I know that's not perhaps the answer everyone wants to hear, but this is a difficult time, and perhaps we need to really think about those principles of co-production that Leanne spoke about, and really start to embed those into our working practice. But, you know, in the short term, you as a provider, speak to us, speak to Sport England, NGBs, you know, we need to speak to Sport England or Activity Alliance, organisations like that have that really good connection with the NGBs, and hopefully can put a bit of pressure or a bit of support to those NGBs in terms of providing the right guidance for sport specific sessions. Yeah, difficult one, very difficult one to answer, but I think that's why we kind of need to work together and maybe have a bit more of a unified voice as a sector around that. I don't know what you think, Leanne. Does that kind of sounds sensible?
Yeah, all of what you said, Alex. Yeah, I don't have much to add to that. I guess from our perspective, because we don't work, we're pan disability and pan everything around physical activity. So it's just broadening people's understanding of what physical activity means, and moving more, and making people feel comfortable that can be done in different ways. It's not, you know, always the norm of going to a club or going to a gym. There's all sorts of brilliant stuff out there now, on the internet and otherwise, where people are having to be innovative and creative to support people, but also to keep their charities, groups, businesses alive. You know, we all have to adapt. So I guess it's just looking at physical activity in the broadest sense.
And what I would say, that could be a really positive thing as well. So loads of us weren't really thinking about activity at home before this happened, and now there's tons of great stuff, and within weeks people were creating these brilliant resources, and that now people seem to be using them. So how can we use them as kind of that entry point, I suppose, into activity for people, giving them that confidence, and hopefully in time they'll be back out at sessions, sort of being active with other people again.
And just to we're just going to keep going back and forth. I just keep getting ideas from what you're saying, Alex. I'll just take this opportunity actually to plug a survey that we currently have out at the moment about disabled people's experience of being active during the pandemic, and that's closing in the next couple of weeks. and we'll be doing the analysis of that kind of over the next month. And the reason we're doing that is because we've realised that we're doing it in partnership with Sense. We've realised that people are really not sure about how to be active at home, but also might have not even considered being active even in the first place. And so it's really important to kind of understand where people are coming from on that, particularly when the stuff that I just referred to, which is really positive, there's tons of stuff out there for people, and we really want to understand, is that right for some of the disabled people that might want to be active but don't know how to be? And so we're hoping to develop a resource off of the back of that. If you tune into our if you sign up to our DIUKE news, then you'll get the latest developments on that as it comes in. So I'd recommend that again.
Thanks both. There's a question about so sector responses are a good solution, but there must be a large concerns around client ability to perform exercises independently, and these would come out higher on risk assessments. So they're talking about, would there be an increase in offer of one-to-one home support? So I guess, is there just kind of around that, is there anything kind of out there in terms of like helping with session planning and thinking about the challenges that COVID has brought up, and how organisations might adapt what they've previously delivered?
I don't know, but there might be, and if anyone listening to this does know, feel free to pop it in the chat. What I would say is that if you're thinking about safety, maybe parents and carers might be really important sort of cohort of people that we need to be engaging. I would say that anyway, but maybe this might be even more important in the context of that particular question. I'd also say that, I might regret saying this, but I don't think I think we don't want to over-egg being risk averse as well. Disabled people are massively more at risk of being active in the home than non-disabled people. So we mustn't not do something just because we're terrified of risk assessments. Vast majority of disabled people are perfectly capable of making that decision themselves. And so what we need to do for people who maybe would need support with that decision is work with those people who can support them to make those decisions. Yeah.
Thank you. There's a question around facilities. So lots of venues and clubs have existing disability activities taking place, but once they can reopen and with capacity restrictions, it may not be viable for them to actually deliver activities for disability groups due to the additional support staff, coaches, carers, parents, etc., that they've always required. Do you have any thoughts on how to overcome this, or groups you know of who have created solutions for this already? And again, it might be that the people on this call have advice for that, so please feel free to comment in the chat. But Alex, I don't know if you want to pick that up first.
Yeah, I bet there are people who have thought some really great innovative solutions around that. It's difficult because it depends on the group and the session itself and the people you're attracting to the group. Some impairments, it would be more difficult, I suppose, to socially isolate. That's why I'd go back to all the resources and the support that is already out there that I spoke about. That Activity Likes resource is great. It's really good. There's also an Access for All guide that they've created. It's much more in depth in terms of, it's for clubs particularly, it's much more in depth, but it gives some fantastic advice on generally how you can make a session inclusive. In terms of the specific situation at the moment, it is tricky. I think certain organisations will be able to give you impairment specific advice around that, but we are learning at the moment. We'll learn from some good practice that we discover through various projects and sessions, and as an organisation we're trying to work with you to come up with those solutions as well, but I haven't got a brilliant answer for that because we're all finding our feet with it a bit.
Just to add to that, I agree with all of that, and just there's one more thing that you could think about is outreach. You don't have to be in the same place that you've always been in to deliver a great service to individuals, and actually it might suit people better for you to do some of that outreach. It probably would have suited some people before the pandemic for you to consider that, and look at the community assets that you have locally. Again, this is where you want to build relationships with your grassroots organisations, and Alex is there to kind of support you with that. But yeah, and I say that because I've been having some recent conversations with really small community organisations who are just coming up with really interesting ways of how they re-engage with their group of people that they support over and above the virtual meetings, you know, as we start to ease out of this lockdown period. And I'm hoping that we'll actually start to be able to share some examples of good practice on that. So again, watch this space. But yeah, hopefully that's a useful tip. Insight.
Yeah, I think someone's mentioned in the chat that it's important to talk to operators around like flexibility around programming time, for example, so that all groups can be accommodated. So that's really helpful. So thanks for that. Someone's asked just a quite direct question about, is there any current funding for local clubs to make sessions COVID safe? I guess from my point of view, I guess as a funder, I know that there's something called the London Community Response Fund that actually might be appropriate for this. So there's some grants within that called Adapt, I think. So that would be for adapting activities to make them COVID safe. So that's definitely worth having a look at, and we will include the link in the chat, but I don't know if you two know of any others.
Yeah, I mean, we work closely with Sport England on their Tackling Inequalities fund, and there are sort of more rounds coming with that. That, you know, Sport England are trying to adapt as well as they can to the situation. Chris will probably know more about that, who's on the chat. Chris Pittico, who's been posting a couple of times, but we are sort of supporting some of the how that is spent in London. And Kerry, you and I want to sort of speak about how we can use the funding that we both have as funders more effectively to make sure it's more joined up and aligned. So it's good to know that that's sort of a particular request, and I'm sure that will be something we can discuss as well. So thank you for that, whoever asked that question.
No worries. Have either of you, because they're coming back to kind of COVID and having to deliver remote fitness sessions, and this has been done virtually, and I know that obviously also like physical activity packs have actually gone out physically to homes. So have either you, Leanne, or Alex had much feedback, I guess, on the success of the remote side of fitness sessions during the pandemic for disabled people, and how successful that's been? I guess it's probably quite varied. I don't know if there's anything specific out there. Yeah,
so we're working closely with Disability Sports Coach. Pete's on this call somewhere as well, I believe, CEO. And they, because they couldn't run their community clubs, they developed these packs and sent them out to people in the homes. And from what I understand, had fantastic feedback around that. I've seen some great videos of people using those pieces of kit just in the home, being really imaginative about how they use that. So that kind of goes back to my point about this, in some ways, can be a good thing, or there are positives to take out of it, because it's people thinking sort of a bit out of the box in terms of how they can be active and not thinking just about sort of traditional sport, I suppose. And we're looking to get those packs out further to as many people as possible across a number of boroughs and through organisations we've identified, and really put some effort into understanding how effective that is and measuring the impact of that, because I think that could be a fantastic way of complementing sort of community sport when that gets back to some sense of normality. It won't just stop activity at home when sort of normality comes back. It's going to be something that runs alongside and can be really beneficial for people for whom maybe going outside creates anxiety or other challenges due to sort of physical impairments or that kind of thing.
Thank you. We've got a question. I'm conscious of time. I'll just kind of round up now. So we have just reopened, and I wondered your thoughts and ideas and signage that can make us more accessible and inclusive. And I guess maybe just answering like a general point around getting communication right to certain groups and making sure you do that right, and any advice I guess you can give around kind of communication and signage around safety guidelines.
There's lots of advice around that, and it'll probably be an hour-long session on its own. So I'll pass the buck, not to you, Leanne, don't worry. And part two, again, some of the fantastic resources that are out there. I've mentioned some of them already, and the Activity Alliance have, but they also have an effective communications guide. Also, in terms of impairment-specific things to consider, British Blind Sport have e-learning resources and other resources you can get through their website. UK Deaf Sport have effective communications training. I know one of the questions that came up as well was specifically around deaf and people who are hard of hearing. So there's lots you can learn from that. Action for blind people as well. Yeah, there's plenty out there, and it's Activity Alliance have most of it if you go to their website for very specific guidance. And it's not just reams and reams of stuff, so don't be put off. There's some very bite-sized, almost like cards that you can use and top tips. We appreciate that. It's not easy to go through lots of these things, and so do lots of our partners. So there's some great stuff out there. Again, if you can't find it, email me, phone me. I'm fine, I'll help you out with that.
Yeah, and just to build on that, I know some of you are probably quite stretched in terms of workforce resource, but don't underestimate the personal touch element of it. There's lots of research and insight out there about disabled people feeling like maybe sometimes front of house, or the welcome that they get doesn't always meet their expectations. With all having good signage is really, really important, but I think sometimes you might need to think about directing your resource to having someone that's even just there to smile, say hello, make people feel comfortable.
Thanks both. I'm conscious that we need to kind of wrap up at 3 o'clock, so thank you both for speaking today and giving up your time. I guess just to finish, could ask both of you kind of one action, I guess, for people to take away after this, to go away and do, whether it's after this kind of action point. Alex, you first.
If you're a provider, I would seek out 3 disability organisations in your local area that you've never spoken to before. If you don't know who they are, ask me, ask Inclusion London, whoever it might be. But even if you just start up that conversation, even if it takes you years, like I spoke about before, at least you'll have started and you start to build that network across London. So yeah, that would be my advice.
Thanks. And Leanne?
Oh, I think she stole mine.
You go first.
I guess actually probably of all the things that you could probably do in terms of the resources that we have, go to our webinar on the social model of disability. I think that will really help you understand where we're coming from when we're talking about how you work with disabled people and the sort of attitudes that people face. I think that's really important. And any questions off the back of that, we're really happy to answer. And we can share the link to that, I'm sure. Thanks
both. So to conclude, I think a Twitter poll has been included in the chat. So if you wouldn't mind just kind of going through to that link and taking part in that poll, if you wouldn't mind. And I guess, I mean, we've spoken a lot today about kind of the guidance and resources there, and obviously information overload, and it all can be quite overwhelming. So I guess as kind of an action for us to really kind of put that in kind of like some concise format and be really clear about specific elements, because I think there's a lot out there. So really try and help break that down for people. But yeah, just to thank you, Leanne, for giving up your time, and thank you, Alex, as well, and everybody for joining. So yeah, we'll conclude there and enjoy the rest of your afternoons.
Right. Thanks everyone.
Bye.
Bye.